I'm Dr. Twaseem and welcome to my classes. Today's lecture is lecture 3 of the etymology series, and this is about bias. We'll delve into what bias is, what are the different types of bias, and how can you tackle bias in a research study. So let's get started. When it comes to results in a research study, the validity is reduced because of two different errors. One is a random error and the next one is a systematic error. We'll have a look at what these errors are. So if you can take a look at the schematic diagram, in the first diagram you can see that all the arrows are pointed in the center and they're close together. So there is both accuracy and there is precision, and this is a scenario where there is no error. And if you can take a look at the second diagram, as you can see, all the arrows are in the center but they are not close together. So there is accuracy but there is no precision. So this is what random error stands for. And the next one is a systematic error. As you can see, the arrows are close together but they are not in the center. So in this case, there is precision but there is no accuracy. So this is systematic error. And bias is a form of systematic error. Another form of systematic error is confounding. So how do we address the random error then? So random error is the error that occurs due to chance factor. So in order to address this, what you can do is that you can increase the sample size. So as the sample size goes up, the chance for random error goes down. But the chance for systematic error stays the same even if the sample size goes up. Now let's take a look at different types of systematic error. So one is bias and the other one is confounding. And in the bias, you have selection bias and you have information bias. So in this lecture, we'll be mainly dealing about bias. So let's take a look at selection bias. So what is selection bias? As the name mentions, the bias that occurs while you select the subjects is called as a selection bias. So how can an error occur while you select the subjects? It can be because of error in procedures that you use to select the study participants. For example, maybe the diagnostic criteria that you use to diagnose a particular condition is wrong. So that can result in wrong patient selection. And the next one is the factors that can influence a study participation. So for example, imagine that you are doing a study among the inhabitants of a particular city, and then you're doing a study in a center and you're asking the patients to come there. If you can think about it, the elderly patients or the differently abled patients would find it difficult to come to that center for the study. So in that case, you're only going to concentrate on certain population of that city. So this is an example for a selection bias again. So now let's dive into what is selection bias in a case control study. So as you all know, case control study is a study where you have cases and then you also have controls, and then you look at the exposure distribution in these two groups and determine what's the association between the exposure and the outcome. So in an ideal situation, the controls should represent the exposure distribution in the source population. So that is the ideal scenario. Only in that case, the result that you get would be the ideal result. But what happens in most scenarios is that the controls actually doesn't represent the exposure distribution in a source population, or in that particular group, what happens is that the exposure might be increased or decreased than the normal source population. So let's take a look at an example. Imagine that I'm going to do a study of smoking causing lung cancer. So in my study, the cases are basically the lung cancer patients. Imagine I'm doing a hospital-based study. So I'm planning to take controls as the patients who don't have lung cancer. But imagine those patients have GI cancer. The probability that they have smoked is higher, isn't it? Because even smoking is a risk factor for GI cancer. So what happens? The exposure, which is the smoking, is actually more among GI cancer patients as well, which means the smoking is more among controls, and it actually doesn't represent the smoking among the general population. So in this particular scenario, what happens is that this can actually underestimate the effect of smoking in causing lung cancer. So let's take a look at one of the published research. So this is a study that set out to look at the comorbidities in lichen planopilaris patients. So it's a retrospective case control study. So the cases here is lichen planopilaris patients, And then you have the controls, which is not diagnosed with lichen planopilaris, and then they have checked at what other comorbidities they have. So in this particular study, as you can see, they have taken a patient registry. So if you think about it, it might not actually properly represent the source population, right? So and they have also found that there are certain diseases that's found to be associated with lichen planopilaris. At the end of the study, as you can see in the limitations, the authors have clearly mentioned the possibility for the selection bias. So this is the importance of knowing what are the possible biases in a study and how you can rectify. So not in all cases maybe you can rectify that, but in that case you have to keep in your mind that the results may be biased. So next, coming to selection bias in a cohort study. So in a cohort study, as you can imagine, the subjects are the people who have exposure and doesn't have the exposure, and they are followed up and then looked for the outcome. So where does the selection bias happen in this case? So as you can imagine, in a cohort study, it's more likely that you have a loss to follow up in the patients, and it might be because of death, it might be because of sickness. So what happens is that when you take these patients into the analysis, there is actually a less number of people in the analysis. So what happens is that we are not able to determine what outcome really could have occurred in the exposed or the non-exposed people. So this is one of the outcomes that can occur if a bias occurs in cohort study. So this can also underestimate the incidence of the. So let's take a look at this example. So this is one of the prospective cohort studies that's been done. So in this case, what they've done is that they've taken immunosuppressive medicated patients with pemphigus, and then they have checked how much they have developed immunogenicity to the vaccine. So they have followed up the patients in a prospective way. So as you can imagine, the one we have studied, there is a possibility for selection bias into analysis. So, and we actually wanted to know what they have done in order to address this. So in the study design, you can clearly see that they have mentioned in the exclusion criteria, they have actually excluded the patient who's been lost to follow up. So this is the importance of knowing the sources of bias, and you need to tackle them in your study. So looking at the strategies to compensate, you need to carefully select the control group in a case control study, the unexposed group in a cohort study, because in a case control study, as we have seen, there need to be a typical representation of the exposure distribution in the source population. And when it comes to the cohort studies, again, you need to minimize the loss to follow-up. So you need to probably keep a backup contact, and you also need to have a standardized follow-up plan so that you have all the patients into the analysis and you don't lose much patients in the follow-up. This is very difficult to correct in the analysis, due to which you need to design your study in a way that the bias is less. So next, let's talk about information bias. So again, as the name suggests, this is a bias that occurs while you collect the information. So the error can happen while you collect the information from the study subjects. So one of the name is called as misclassification. So misclassification means that you have classified it wrong. So it can be differential misclassification or it can be non-differential misclassification, which means differential means they are different in cases and control groups. If non-differential means the misclassification is the same between the cases and the control groups. So non-differential misclassification can occur both for disease and also for exposure. So in this case, what happens is that the bias can move towards a null. Null is 0. So it can say that probably there is less association or a no association. Let's take a look at the example. So this is a study where the psoriatic patients are checked for development of psoriatic arthritis. And let's look at what misclassification can occur in this case. So if you can look at the limitation, they've clearly mentioned that psoriatic arthritis can be misclassified by dermatologists. So as you know, a rheumatologist will have an upper hand in diagnosing psoriatic arthritis. So in a case where dermatologist is not very trained, there might be a misdiagnosis, and this can result in misclassification. But this can occur in both groups equally. So this is a non-differential misclassification. Let's take a look at the differential misclassification. So again, as mentioned, it's non-random, so the bias can go in any direction. So it can overestimate the effect or it can underestimate the effect. So to make this clear, I'll just take you through some of the tables and numbers so that you get an idea about what this really means. So in an ideal scenario, imagine a case where I am taking exposure as smoking and the disease outcome as psoriasis. So we have smokers and psoriasis development. So I have grouped the numbers in this 2 by 2 table, and from this the odds ratio that I derive is 4, which means the smokers has 4 times odds of developing psoriasis. So what happens in a non-differential misclassification? So there is a misclassification which is 50% among both cases and controls. So if you can compare with the previous table, you can see a 50 number has changed. So this has resulted in change in the number of subjects. And now when I calculate the odds ratio, I'm getting it as 2.5. So what has happened? It has moved from 4 to 2.5, which means it has moved from 4 towards the null. So this is the effect of non-differential misclassification. Let's take the example of differential misclassification. So as I mentioned before, differential misclassification means misclassification only occurs in one particular group. So imagine that this has occurred only among controls. So in this case, the odds ratio that I'm getting while calculating is 10. So the odds has gone higher. So as we've learned before, the odds can go up or the odds can go low. So this is the effect of differential misclassification. Another form of information bias that can occur is ascertainment bias. For example, in a cohort study or an experimental study where you know, for example, smoking causes lung cancer, you're probably going to observe the smokers group more closely for development of lung cancer. So that is called as the ascertainment bias. So it's a type of information bias. Another thing is recall bias. So this generally happens in retrospective studies, especially the case control study, where the cases are more likely to recall their events or the exposures. And there can also be interviewer bias, where the interviewer asks the cases again and again for the exposure history because they suspect that it's more likely that the cases have more exposure. And and also sometimes the error can occur while recalling equally for both cases and controls. So these are different types of information bias. So what strategies can you take in order to rectify information bias? We need to use a very high validated measure so that there is no error while calculating or while selecting. There is no misclassification, and you can rely on records when possible so that there is less likely to be an interviewer bias or a subject bias like a recall exposure. And you can also mask the study hypothesis, which we call as blinding of the study hypothesis. And then normal blinding, where you blind both the investigators and the subjects so they don't know actually what's happening. So this is generally done in an experimental study. And then also we need to use standard follow-up procedures, especially in cohort studies, so that you don't lose much patients to follow up. So these are the different strategies that you can devise in order to mitigate the risk of information bias. So I hope that this lecture has helped you to have an understanding about what are the different types of bias and how you can tackle them while reading a research article or while doing a research study. So hope this has helped. Thank you. So these are my references.